filter in from the waiting room. Hi, everyone. We'll give everybody just another minute to filter in from the waiting room. In the meantime, feel free to put in the chat your name and where you're from, just so that we can see where everyone's coming from. So hi, everyone. We'll give everybody just another minute. We still have a few people in the waiting room. Oh, we have someone from Iowa. Hi, Elaine. From Los Angeles. I'm also from Los Angeles. All right, we'll give everybody just another 30 seconds or so, and then we'll go ahead and get started. Hawaii, wow. We have people from all over. That's great. All right, I'll give everybody just another 10 seconds to filter in. We have someone from Seattle. All right. So I'll go ahead and get started. If anybody else joins us, we'll admit them during the presentation. But thank you all for joining us today for Train the Advocate 104 Advanced Care Planning. My name is Leslie Chinchilla, and I'm the State's Advocacy Senior Organizer for Compassion and Choices. I've been with the organization for about 4.5 years now, and I'm based in Los Angeles, California. So the goal of Train the Advocate really is to help advocates feel comfortable having meaningful conversations, learn how to present to their community about end-of-life care options, and grow the movement. And throughout the year, we offer various different Train the Advocates. Some are on topics such as medical aid in dying. We have a few on VSET. So we welcome you to join us in any of those presentations. And if you ever do want to give a presentation to your community, we do send all our volunteers the slide decks with some notes as well so that you can mix and match to whatever topic you're presenting to in your community. And today, like I said, the topic will be advanced care planning. So just to talk a little bit about why it's important. 93% in a recent poll, it showed that 93% of people said that it's important to have an advanced care directive, but only 30% of adults have actually completed it. And only 12% have shared it with their doctor. So in this training today, we'll learn evidence-based impacts of advanced care planning and the importance of documenting your wishes, having conversations with your loved ones and your healthcare provider to help you have the end-of-life experience that matches your values, priorities, and beliefs. You'll also be provided with all the resources and information to help make this process easier. So like I said today, I'll be speaking to you as a presenter in the same way that we hope you will present in the future. Next slide, please. And I forgot to mention, but my colleague Valentina Turner is also on the call. She's helping with all the check stuff. So big shout out to her because I cannot do it without her. So a few tips, just please, we ask you to keep yourself on mute just so there's no background noise. And if during the presentation you accidentally come off of mute, we will put you back on mute. So please don't get offended about that, but we just want to make sure that there's no background noises there. We also, just so you know, at the end of the presentation, we will have time for Q&A. So throughout the presentation, if you have any questions, just feel free to drop those into the Q&A box or the chat box, and we'll try to get through as many of them as possible at the end. And also just a quick note, this presentation is for general information. So if you do have a specific question about a personal situation, we can connect you to our end-of-life consultant. Next slide, please. And just very quickly, I want to go over our group agreements. So we ask that you use I statements. Life happens, but try to minimize any distractions. Build upon, try not to repeat. Move up and move back, so allow equal airtime. And ask questions by raising your hand or writing in the chat. Next slide, please. Now, when we're doing presentations, we always like to start with our mission statement, so I'll go through that right now. Compassion Choices is the nation's oldest, largest, and most active nonprofit, working to improve care, expand options, and empower everyone to chart their end-of-life journey. We believe in patient-directed healthcare, where patients should have the ultimate decision of choosing treatments that align with their individual priorities. Patients and healthcare professionals should work as a team, and the doctor should not make such decisions alone. Again, this is our mission statement that we like to start with when we're giving presentations, just so the audience gets to know a little bit more about what Compassionate Choices does. Next slide, please. There we go. So now I just wanted to do a quick activity. So if you have any paper or pen handy, go ahead and reach for that. And if you happen to be maybe on your laptop or your iPad, you can just pull up maybe the Notes app or a Google Doc. But I just wanted everyone to write down the 5 things that are the most important to you at the end of life. So a few examples are maybe time with loved ones, being with your pets, being free from pain, not being a burden to loved ones. So anything like that. So go ahead and give everybody a minute just to get some pen and paper and write down those 5 things. So I'll step back and give everybody a minute there. And I also have my pen and paper handy, so I'll go ahead and do it as well. So I'll give everybody another maybe minute just to think through. So I'll give everybody another 30 seconds or so just to write down those 5 things. Alrighty, so we'll go ahead and move on, but just keep this list in handy because we will be using it, coming back to it later on in the presentation. Next slide, please. So advanced care planning gives you the opportunity to have an end-of-life experience that matches your values, priorities, and beliefs. It gives you the chance to reflect on what's most important to you, decide what kind of care you want or don't want at the end of life, and gives loved ones the way to implement critical, informed decisions on your behalf, free of guilt. Not having these conversations can often leave your loved ones in disagreement, confusion, and grief. There's actually a lot of evidence behind the benefits of advanced care planning, and more importantly, the process of discussing and documenting a person's wishes, preferences, and goals of care. To name just a few, evidence has shown that advanced care planning promotes patient-centered care by focusing on the patient's preferences and helps ensure that they receive the care consistent with their preferences. It also reduces the decisional burden of loved ones as to whether they're making decisions that are consistent with the preferences of a loved one. It also improves the bereavement experience of loved ones by reducing stress, anxiety, and depression after a loved one's death. It also decreases in-hospital and intensive care deaths. It reduces the cost of end-of-life care without increasing mortality. And it improves outcomes and patient experience while reducing health-related costs for high-risk, high-needs patients. And just to talk a little bit on a personal note of why I think it's very, very important. So about a year ago now, my father unexpectedly had a heart attack. He ended up in the hospital in a coma for about 2 months. And it was very ironic because obviously I work with an organization where we talk about this all the time, but that's something that he just refused to talk with us. We never did any advanced care planning, never even touched that conversation. And then it got to the point where, we had to decide whether we wanted to keep him on the ventilator or go through comfort care. And honestly, it was difficult. It was very, very difficult because, like I said, we hadn't really had these conversations. So it felt more like a guessing game, of what would he have wanted. Um, and ultimately we did go with comfort care. We were all there. But it's still difficult. It's difficult because you have that, I think, behind your head of, did we make the right decision? Is this what he would have wanted? So just from a personal note, I think that really drives in for me why it's so important to have these conversations. They're not always the most comfortable, but they're very, very important. Next slide. So to begin thinking about advanced care planning, we encourage you to ask yourself some important questions, such as, what are your values and goals of medical treatment? How do you define life? What matters most to you? What brings you joy? We have here at Compassionate Choices our end-of-life decisions guide, which is very helpful and walks you through this part of the decision-making process. So it has different statements such as preserving quality of life. How important is that to you? So you'll rate it from 0 to 4, of least important to most important. And again, it just helps you think through those questions and really prioritize what's important to you. And that resources is available in on our website. You can either download it or we can also ship it to you. So if you are interested in that, I'll go ahead and send the link after the presentation. Next slide, please. So what is an advance directive? An advance directive is a legal document that outlines end-of-life priorities. The documents only go into effect if you lose the capacity to make your own decisions. The two most common types of advance directives are called a living will, where you include the care that you want or don't want, and then a healthcare proxy, which is who you're choosing to speak on your behalf in case you're not able to do so. And when you fill out an advance directive, you actually don't need an attorney, but you do need two witnesses. And to talk a little bit more about the living will includes information on resuscitation and life support. However, you can also add in information in regards to other end-of-life care, such as pain control. A living will may not be applicable to every situation. However, continuous discussions with your healthcare proxy and healthcare provider around your values, along with your documented preferences, will provide the best guidance to help have your wishes honored. And advanced care planning is a continuous process, so getting it done is just step one. What we don't want happen is you fill it out and then never look at it again, right? Because things do happen, so that we do recommend that you review your advanced directive after one of the 5 Ds occurs. So for those of you who aren't familiar with that, the 5 Ds are divorce or anytime there are major changes, anytime there's a significant decline in your health, at the start of each new decade, if you receive a new diagnosis, or when you experience the death of a loved one. So again, write down your advance directive, fill it out, but also make sure that you review it in case there's any changes that you want to make. And I also do want to note that since state laws do vary, you will need an advance directive from your state. So some states will honor your advance directive from another states, but some might not. So we encourage you to check with your state about those specific laws. Next slide, please. And right here, you'll just see a graph, which is a documented end-of-life wishes by race and ethnicity. So you'll see that the big disparity between non-Hispanic whites who have filled out an advance directive compared to African Americans and Hispanic and Latino Americans. So there's a few different reasons that this disparity occurs, some of which are culturally competent communication. So one example is in English, we say hospice. In Spanish, the translation usually is hospicio, but in Spanish, that means an orphanage. So there's different barriers there. You also see sometimes there's materials that aren't translated, so they don't know the information. It's also important that there's trust between people and their healthcare provider, and systemic issues within the healthcare system may have led to broken trust due to take decades of discrimination. So that's something else that can be a reason for this disparity. Next slide, please. Now, I just want to go over choosing a healthcare proxy. So this is a very, very important thing. So when you're looking for a healthcare proxy that's a good fit for you, you're looking for someone who understands what's important to you, someone who you trust will carry out your wishes, someone who knows how to advocate, someone who will be in the right emotional place, and someone who will be able to navigate the family dynamics. So who someone chooses really varies person to person. Some might choose a family member, some might choose a friend. It really varies. Like for me, I wouldn't choose my mom just because we have very different religious beliefs when it comes to healthcare stuff. So that wouldn't be a right fit for me, but that might be a right fit for somebody else. So it really depends, but the most important thing is that you choose someone that you know will advocate for what you want, regardless if someone else is disagreeing or regardless if they even disagree with it. So it's very, very important that you think through and choose someone that you know will honor your wishes. Next slide, please. All right, and now, as promised, we are going back to our activity. So if you have your paper there where you have those 5 things of what's most important to you, I'd like you to look for it and then just cross out 2 of them. So cross out the 2 least important of the 5, and then we're going to be left with your 3 most important. So I'll give everybody maybe a minute or so to just do that. And like I said, I'll do that activity as well. So let's give everybody a minute. So get your list and let's cross out 2 of them. All right, and we'll give everybody maybe another 30 seconds or so. All right, we'll go ahead and give everybody another maybe 10 seconds or so. Alrighty, so keep that list in handy. We're going to use it one more time later on in the presentation. Next slide, please. Now I'm just going to go over a few additional documents to consider when you're advanced care planning. Next slide, please. So we have the allow natural death / do not resuscitate, which lets hospital staff know that you would like to allow a natural death and don't want to be resuscitated by CPR. These direct hospital personnel to not attempt CPR if your heart or breathing should stop while you're in the hospital. Discuss with your doctor whether such an order is appropriate for you. However, most cases of CPR do occur outside of the hospital. So for that, we have the Pre-Hospital Medical Care Directive or out-of-hospital DNR form, which informs emergency personnel outside of a hospital setting that if you would stop breathing or your heart stops beating, they are to allow natural death and not to start CPR, nor use equipment, drugs, or devices to restart your heart or breathing. If you're terminally ill or elderly, talk to your healthcare provider if you're interested in an out-of-hospital DNR. And just to talk a little bit more about CPR, while it can be beneficial, it can also have some complications. Among a few are that chest compressions can cause fractured or broken ribs, pulmonary hemorrhages, and broken sternums. And brain injury can also occur after cardiac arrest. Complications vary, and they do depend on a person's age, their current health, and how long it takes to resuscitate the heart. So I know oftentimes when we see shows, like I'll use Grey's Anatomy as an example because I watch that show all the time. It's a medical show, but you see someone perform CPR and it's a very easy process, and then boom, magically the person's back to normal. But like I said, that's not the actual reality of it. So there are complications. So just pointing that out there because it's something to consider when it comes to CPR. And just to note, if your loved one dies at home and they have a DNR, you also don't need to call 911. Instead, you can contact your doctor, a local medical examiner, a local health department, or a funeral home representative about how to proceed. And lastly, I'll talk a little bit about the pulse. So it's either pulse, most, or most. It depends on what state you're in. But pulse stands for physician orders for life-sustaining treatment. A pulse is for seriously ill or frail patients near the end of life. After having discussions with your doctor about what end-of-life treatments may be appropriate for you, this is a medical order completed by your healthcare provider and gives orders to other healthcare professionals about how to treat you in an emergency. It's signed by the healthcare professional, and the patient keeps the original and prints it on a bright pink paper or bright green, depending on your state. And just to note, a pulse is in addition to a living will and healthcare proxy, but it does not replace it. So a pulse, I think maybe some of you are familiar, but it is a really, really bright pink form, so it stands out, and you can put it on your fridge, you can put it somewhere safe, but those are a few other forms to consider when you're doing your advanced care planning. Next slide, please. Now, I'll just talk a little bit about our dementia values and priorities tool. So we know that nearly 50% of older adults die with some form of dementia, yet the standard advanced directives don't address the complex and unique needs of people living with dementia. At Compassionate Choices, we have our dementia values and priorities tool, which will help you think about and document your wishes regarding the type of care you want if or when you are living with advanced dementia. This is a free online tool available on our website to help people document their wishes regarding the care they want or don't want as dementia progresses. And I can also send a link to this tool at the end of the presentation in the follow-up email. Next slide, please. So quickly, I do also want to touch on our particular wishes tool. So this addendum, which you can add to your advanced directive to state your wishes regarding specific life-sustaining therapies. So this addendum is 10 questions about whether you want treatments like antibiotics, dialysis, electroshock, artificial nutrition or hydration, steroid treatments, or any other life-sustaining therapies. So when you have the options there, you click either yes, no, or trial period. And if you do click trial period, all that means is that you'll allow doctors to see whether the therapy quickly reverses your condition. And if it doesn't, then they would discontinue it. Next slide, please. And I also do want to highlight our diagnosis decoder. So this tool helps you generate specific questions for your doctor, nurse, or other healthcare provider, questions designed to get you the complete information you deserve, because no one knows more about you, obviously, than yourself. So this is another great tool that we have on our website, which again, I will send after the presentation. Next slide, please. And I know I've mentioned this before, but I just want to repeat it because it is really important. Having your advanced directives written down is just one step. Having conversations with your loved ones and healthcare proxies are key. So I know, again, these conversations are not always the most fun, but they're very, very important. You don't know what life's going to throw your way, and it's better to be prepared and have these conversations early than, God forbid, something happens and then there's no preparation. So again, these conversations, they might be uncomfortable, but they are very, very important to have. So I encourage you all to have those conversations early. Next slide, please. And now we're going to go back to our paper. So now that we have 3 listed, now I want you to cross off 2 more so that you have the most important thing to you. And I'll give everybody, again, another maybe minute just to cross out 2 more and just leave you with the most important thing for you. So I'll give everybody maybe another 30 seconds or so. All right, I'll give everybody just a couple more seconds and I'll just share mine where what I was left with. So for me, the most important was being with loved ones. That's the most important for me. And if any of you are comfortable saying what's most important to you, I'll give everybody 30 seconds. And if you're comfortable sharing, just feel free to unmute yourself or maybe drop it into the chat box of what's most important to you. I'll read a few that I'm seeing in the chat. So not being a burden, love. Yep, these are all great. Like I said, feel free to unmute yourself or just drop it in the chat. So I'll give everybody a couple more seconds. Avoid nursing home, dying in a calm, peaceful environment, comfort care, die at home with dignity, being with loved ones, free of pain. That's great. Thank you all for sharing. All right, we'll go ahead and go to the next slide, but keep putting those in the chat. I love reading those. All right, so as we wrap up this presentation, I just wanted to highlight some ways that you can get involved in this work. There's many different ways to get involved. Something as simple as liking or following us on social media. And you can also volunteer with us and help share about our mission. So with volunteers, there's a variety of different activities that our volunteers do. Some volunteers love to do presentations, some don't. So some like to go to conferences, some like to table, some like to reach out to organizations. So there's a variety of different activities for our volunteers. And if you are interested in volunteering, feel free to reach out to me. We'd love to connect you. There's actually usually local action teams that we can connect you with. So if you're interested in that, please let me know. Another way to get involved is you can donate to us. So donations help to continue this effort. 96% of our funds are from individual donors like yourself. So if you are interested in donating, I'll send the link to that as well after the presentation. Any donation, if you're able to, helps us continue this very, very important work. Next slide, please. And just quickly, I wanted to highlight a few of our upcoming events. So we do have our Medical Aid in Dying Legislative Roundup and Session Highlights. That's a national event, and that'll be October 3rd from 2 to 3 p.m. Eastern. And we also have another Train the Advocate, which will be focused on our LGBTQ plus advanced care planning toolkit. So that one will be a great training, so I highly recommend it. It'll be October 18th from 3 to 4 p.m. Next slide, please. And with that, I'll just open it up to questions. But again, I hope you all, with this presentation, it's just kind of giving you an insight of how presentations work and hopefully encourage you all to give those presentations in your community. But if you have any questions, I'll check the chat box. Valentina, if you've been seeing that chat box, you can also let me know. Or I think there is one, but someone asked if we're going to be sending the slides, and we will be sending it after the presentation. And like I said, if you ever have a presentation on a specific topic, we usually do have those presentations already made. So we can just send it to you and you can just adjust it to your audience. So we're always happy to do that.
Hello. I had a question. Hi. I had a question about so you mentioned trial period. Um and in filling have tried to fill out the most form in where I live. And there's these questions about DNR or not, yes or no. And then I found myself wanting to say something like something could be tried, and there is a place for something could be tried. I don't know how they put it. But my concern, and I just it's sort of a question and a concern, if you put down something that indicates a trial period, but not you don't want it forever,
Mhm.
um, you know, who makes the decision? If you're not able to communicate, who makes the decision, when the trial is over? Like, does it get murky and muddy?
Mm. Well, for if you have a living will, then I believe that would be the physician who makes that decision, which is one of the things of, to your point, maybe the ambiguity is that the
Hmm.
fear, right? Because it's hard to interpret, or even your healthcare proxy. So I think that's why it's very important to have the conversations and really be specific of what a trial period means, because I think that is a very important point of it can be ambiguous and then people might interpret it a certain way that you might not want. So yeah, when it comes to the living will, I believe the physician does. And if you have a healthcare proxy, it would be the healthcare proxy.
Mm. I know that the living will is not passable in certain states either.
I'm not sure about that, but I know living wills are a part of the advanced care directives, and usually the advanced directives do have a section for that where you go over
Hmm.
your medical treatments. But that's why they do ask when you're filling out that living will that you're as specific as you can, just so that there's no room for interpretation that you might not want. So really try to be as specific as possible when you're filling those forms out.
Hmm. Thank you.
Mhm. And then Valentina, I think you said someone else had a question. Can't find it, but if you're able to just let me know what that question was. In the meantime, I'll just
Oh,
ask that I'll see this, or if someone's asking a question, sorry if I'm cutting you off, or Valentina.
no, you're fine. Julie Moore just asked, is there a link to the particular wishes page?
Yeah, so I'll send that over after the presentation. So after the presentation, I'll send you all an email. It should be coming from me, and then it'll have a link to everything that we went over, but it'll also have the slide deck. So in the slide deck, you can actually click through the different resources and it should redirect you to that. But at any point, if there's any resource that gets maybe not delivered, just let me know and I can always just send you a link to all our resources as well. And I know there's a question here. Would this presentation usually be followed by going over the CNC EOL guide booklet? So it really depends on what type of presentation. So for Train the Advocate, we're really just going over a general presentation, right? But we do have a few of our volunteers who do workshops. So they call them workshops and they actually go through the entire end of life guide booklet with their community. So we've been doing that actually in San Diego, where our volunteers, they do it both in English and Spanish because we have it in Spanish. And they'll just actually take the booklet and then go over it with their community. And we've been having a good success with that. But yeah, you can definitely do it after a presentation. It really is up to your preference of what type of presentation you're giving or what point you really want to make. But yeah, that would be something great because I think filling it out and the spot is actually really good because some of us, I think me particular, I always say I'm going to do something and I never do it. But if I do it in the moment, I think that would encourage me to actually fill it out. And Chris, I see your hand up.
Thanks very much. That was an excellent presentation. Thank you very much for doing it. I had a question about dementia and medical aid in dying. I know right now, where medical aid in dying is legal, you can't take advantage of it. People with dementia cannot use it because you have to have decision-making capacity. And obviously with dementia, you don't have that. But do you ever see a time when the law might be changed and people with dementia might be able to take advantage of medical aid in dying? And would you just talk a little about how that might work?
Yeah, absolutely. So thank you for the question, Chris. So, obviously, with all our laws that we implement, we really have the boilerplate language, which is that mental capacity. We don't anticipate adding it just because that is one of the safeguards that we have. And as it is, when we go into the legislature, it is already difficult. There's legislators that have already the fear that there's no safeguards. So that's something that is part of our bill language that we don't anticipate changing, but that's why we do work really hard with our dementia values and priorities tool, just to make sure that we are still doing that work. We do a lot of presentations specifically for dementia, and we've actually done a few train the advocates specifically for that. But yes, as of now, there's no plan for that, for adding dementia into accessing medical aid in dying, because like you said, there's not that mental capacity. So by the time dementia gets into the terminal diagnosis, by that point, they usually don't have the mental capacity. And it's not something that you can write in your advance directive ahead of time.
Great. Thank you very much.
Of course. Are the forms and tools you mentioned in my end-of-life decisions and advanced planning guide and toolkit? So most of the forms are in that toolkit. It's a very thick toolkit. So it usually has the advanced directive in different forms. That's why I highly recommend that you order it. Like I said, they're completely free. So if you want to download it, then you can just have it with you. Or if you want me to mail it, I can also mail it to you. But it does go over the different forms that I talked about in the presentation. And then there's a question, what is the difference between the end of life guide and my end of life decisions and advanced planning guide? So the end of life guide, I think, let me see if I saw that one in the presentation, but both of them are pretty similar. They have pretty much the same resources. It's just the main focus for those are getting you prepared to have the advanced care directive conversation. So the tools are pretty similar. It just has different questions like the My Priorities and Values tool, which again, I personally like a lot because it really forces you to think of, preserving quality of life. How important is that to me, actually? So it's very comprehensive. Like I said, all of those are available on our resource page at Compassion Choices, but I can also send you a link specifically for those two things. And how do we contact you? So you should be getting an email from me, I believe. It should be sent from my email address. And I'll drop my email address in the chat actually, but the email should have my contact information and my phone number as well. So if you ever have questions or have any additional questions that you're not thinking of right now about the presentation, you can always contact me via email or even give me a call on my work phone. I'm always happy to arrange that. Yeah, because like I said, presentation usually in the moment, it is a lot of information thrown at you, so it's kind of hard to digest it and then think of questions. So I'll put my email right now in the chat, and you guys can feel free to contact me with any additional questions, or if you want to give a presentation to your community, feel free to reach out to me. Because for those presentations as well, depending on if you do them either in person or Zoom, especially if it's on Zoom, I'm always happy to jump on with any of the tech stuff because sometimes it is hard to share your screen and then monitor questions or keep people on mute. It takes a lot of work. So if you're ever giving a presentation and just need that technical support, I'm always happy to help. So I'm happy to jump on or also jump on with the question part of it as well because I think that was for me when I first started the most daunting part of presenting is the question part. Because I mean, the reality is sometimes you don't have an answer to everything. So that's one tip I will say if you're ever giving a presentation and you don't know the answer, just be honest, let them know. I don't know the answer right now, but let me write it down and I'll give you the information after. I find that's better than maybe trying to come up with an answer or giving them false information. So that's one tip I'll share with you all if you're ever presenting and you're getting nervous about the question part of it. Like I said, I can jump on and help you or, write down the question and just let them know. We'll answer at some point.
Could you tell us your name? I came in a couple of minutes late. Could you tell us your name? I see it's your last name is Chinchilla
Yeah. So
and
Leslie
Leslie,
Chinchilla.
Leslie, Leslie Chinchilla. Thank you, Leslie. Sorry, I didn't see your name.
Yeah,
Thank you.
no worries. Yeah, and right now, so I'm with what's called the Finnish Strong State. So I oversee California and 12 additional states in the west side of it. And then Valentina, who is helping me out, she oversees the east part of it. So if you do reach out to me and I see that you're on Valentina's side, I can just connect you with her. But I'm always happy to answer any questions. And I had a great question, Virginia. Are there any specific places where you think it's most beneficial to do these presentations, such as senior centers or libraries? So, yeah, senior centers are, I think, mostly where we get our volunteers give presentations. They usually make a list of senior centers around them, and what they do is they reach out to them. So either via phone or some of them actually go in person. And I've done that with my local senior centers. So I like to just go in person and just drop off some materials and tell them, hey, these are some of our materials. This is Compassionate Choices. Would you ever be interested in any presentations? Other places to consider, hospices sometimes give presentations. I would say sometimes even schools. I've done a few presentations at college campuses because they have policy classes and they want to learn more about either medical aid in dying or something like that. There's also caregiver groups, I think is huge as well. I try to reach out to those organizations. But we do have a list of different organizations that you can reach out to or partner up with. There's usually, I like to reach out to, LGBTQ centers as well because we have our LGBTQ plus advanced care planning toolkit. So that's another good avenue. And Sally, I see you have a question as well.
I'm relatively new to Compassionate Choices, like probably 5 months, and I've probably done 15 webinars and in-services and trainings. But I know to your staff, all of your titles probably are crystal clear in what you do. And my suggestion is that somewhere in the training there be kind of a list like a corporate ladder of who does what and some of the names. I know there's over 100 employees, so obviously you wouldn't do all that, but even what departments, because a lot of the titles sound very similar to me
Yeah.
and don't really have specific meanings. I mean, I think you're all great. I don't have a problem with that, but like, I'm not sure sometimes who I should contact with a particular question or concern.
Yeah, and
But
that no, I hear you on that, Sally. I'll be transparent with you as I get confused sometimes with all our organization as well because there are so many different departments. Particularly for me, we have a communications department and a digital department, and I get them mixed up all the time. So I think that is a good suggestion, or at least maybe a chart of just myself, Valentina, and Angela, so that you can kind of see who oversees what states or maybe a little more
that would
information.
be helpful. But I
Yeah.
know like when I filled out the volunteer consent forms and everything, they were talking about if media contacted you, you should contact this office, but it didn't, there wasn't any contact information, things like that. So
Mhm.
sometimes just to have like one page overview of what's some of the departments that you have and what their jobs are in just, I mean, short
Yeah.
things, but yeah, I think what states each one of you covers is probably important too, but thank you.
Yeah. And that's a great suggestion. I'll run that by Angela because we have these trained advocates, like I said, usually quarterly. So yeah, maybe in the beginning we can spend 5 minutes just kind of reviewing where each of us works. So thank you for that suggestion, Sally. I don't see any other questions, but if you have any questions, I'll give
Leslie, I
it a
have,
minute.
um, and maybe this question's outside of the scope of the train the advocate, but I'm just curious in terms of compassionate choices policy work. My question's about what DNR means and how it's interpreted by medical personnel, and does compassionate choices kind of engage in that discussion anywhere, and is there anywhere else to learn about that?
Yeah, so do not resuscitate. I know we have a medical outreach department and they usually work with emergency personnel and hospices and everything like that. They're a lot more engaged with that because that is one um concern or things that volunteers have brought up of how do I know they'll honor the DNR in an emergency. So that is something that we're having ongoing conversations with. I would say Jessica Empeño, who works in our medical outreach department, she'd be a great resource. So Karen, I can definitely connect you with her just so that you can talk with her because she works a lot with that. So she'll be a great resource.
That would be great. And I actually think it is relevant to advanced directives because if I'm filling it out and I'm only thinking about cardiac arrest, then I might answer questions differently than,
Yeah.
so there are many other things that.
Yeah, absolutely. Yeah. And that's something that usually when we do give advanced care planning presentations, I think that's one concern that we see a lot of, specifically with DNR or CPR, of how do I know they won't give it to me? Like, how do I know that they'll honor it? So that is an ongoing conversation that we're having. But like I said, I'll connect you with Jessica because she works very closely with that and she can give you a lot more information. Oh, we have someone who can actually comment on DNR. So Stephanie, yes, feel free to unmute yourself.
Yeah, I just uh the DNR, it's a little bit difficult because there's two of them. There's out of hospital and then there's in hospital. And regardless of what your out of hospital DNR form states, it can always be changed in the hospital. And even if your full code, meaning like do resuscitate out of hospital, at any time if you're admitted to the hospital, you can change your mind and say, I want to be DNR, but they don't interact. So you have to say it in both kind of settings. And I think one of the most important things is one, do people know that you have it? So the problem is if EMS shows up to your house and no one knows that you've signed an out of hospital DNR, the safest thing for them legally is to do everything because you can't take it back if you don't. And that's probably the biggest problem is the form isn't readily available, or the family isn't aware that that form is signed. And so no one advocates. And so EMS just has to do the thing in the moment that's safest for them. That's irreversible. And then in the hospital, it's always respected if the patient says so, but the problem is when the patient is not clear on what they want, and then the family has a different opinion. So I would just recommend this is also for the advanced care kind of planning. Choose a healthcare advocate, so a medical durable power of attorney, or whoever your person is that you choose that agrees with what you want, that knows what you want and will do what you want. Because the problem is usually when the family wants everything done, regardless of what the patient says earlier, the family can always make decisions, unfortunately.
Thank you so much, Stephanie. And I know one of our volunteers, and I don't know if you've seen this, Stephanie, but one of our volunteers, he was a physician. And I think he said he has like a DNR bracelet. I don't know if you know where we can get those, because that's something that he said of he just has it on his wrist just so that it's readily available.
Yeah, I think they make like medical alert bracelets that will say that, and I think you can get any commercial like product that says that. Unfortunately, it's not legally binding, because you need a form that's one that belongs to the state, so like a state form, and you need it signed by yourself and a physician, and that's the only legally binding form. The only thing that helps with having one of those bracelets is that it directs people to go looking for a form that might be uploaded in their medical chart, or that might be in their possessions. So it helps the team know kind of what the patient wants, but it's not legally binding, meaning if that's all they have is that bracelet, it's not safe for EMS or a physician to not do CPR in that case, because they can always be sued by the family saying, well, there wasn't a form signed. And that's really the issue, unfortunately, is being sued is everyone's biggest fear, because families can disagree, right? Families can want everything done. And so, unfortunately, if the family wants everything done and the patient doesn't, but there's no legal form, then you have to kind of play it safe.
Yeah. Thanks so much, Stephanie. I'm going to check the chat box to see if there's any other questions. And I think there was one question of if there's access to the past Train the Advocates. So those should be on our YouTube page, I believe. If you go on YouTube and put Compassion and Choices Train the Advocate, all of those should be there. So yeah, you can access those at any time. And like I said, we usually do them on a quarterly basis. So if you miss this one, next quarter, we should have another one on advanced care planning. Like I said, if you think of any questions after the presentation, just feel free to reach out to me. I'm happy to answer them. We do have a question if there's a relationship between compassion choices and death cafes. So our volunteers are doing a lot of death cafes. Where we have in San Diego Death Talks. So Mitz Tomita is one of our volunteers, and he actually does death talks. And one of our volunteers, Stephanie Elkins, also does Death Over Draft. She actually founded that, and she does them all over the country now. So yeah, we definitely work with those. Especially, I don't know if you all have seen it, but we have our death deck now with Compassion and Choices. So it helps you, it's kind of more of a more fun way, I guess, to talk about this subject matter. But yeah, death cafes or death talks, those are, I think, a really great way to start the conversation. Yeah, those we've been doing those across the country. And yeah, Stephanie and Lisa Paul, who created the death deck, those have been very successful. Like I said, it just helps kind of break the ice of the conversation. Yeah, and if you're interested in doing any of those, usually we can help out with planning it or reaching out to local volunteers so that they get that information. So if that's something that you want to plan, just feel free to reach out to me. We can connect you with our volunteers who have done those before and kind of let you know. It might seem daunting, but I know in San Francisco, one of our volunteers, he started with like 2 people showing up. And now I think the last time he did it was like 20 people. So yeah, I think those are great. I love going to them, and I live in Los Angeles, so they usually have some around here. So that's always something great. If you look up death cafes near you, there should be one, hopefully. And yeah, I would highly recommend going to those. I don't see any other questions, but like I said, if you think of any other questions or if you're looking through the slide deck and have questions that pop up, just feel free to reach out to me. I'm always happy to answer those questions, or if calling is easier, just feel free to give me a call as well. And I'd like to just thank Valentina, who's doing the behind the scenes stuff, for helping me with this presentation. And I'd like to thank all of you again for joining us and sharing your list as well. I really, really appreciate it. And we appreciate all of you. And hope, like I said, we'll send that email hopefully in the next couple of days or so. So you should be receiving that. If for any reason you don't receive it, I put my email there, but feel free to reach out to me. And again, thank you all. And I hope you all have a great rest of your day. Bye, everyone. Take care.